Our next presenter is Dr. Michael Verbora. He has an MBA and teaches at both Seneca College and McMaster University. He also serves as the Chief Medical Officer of Aleafia Health and is the Medical Director of Field Trip Health, a mental wellness company focused on psychedelic-assisted therapy. Please welcome Dr. Michael Verbora. Great to have you, Michael.
Hi, thanks so much for having me, and thanks everybody for participating today. And it's a great opportunity to share a little bit about my life's work and what I'm so passionate about. And my story really is just, I'm a physician, graduated about 6 years ago, been working as a family medicine doctor, and I just really struggled with the notion that, pills were the solution for a lot of my patients. And I felt that they have lost touch with the healing component of medicine. And so it led me on a pursuit to help my patients. And it first led me to medical cannabis, and where I'm now the Chief Medical Officer of Aleafia Health, a medical cannabis company focused on, helping all sorts of people with ailments. And, that was a great step forward. And I saw what healing potential cannabis had. And patients then clued me into the fact that, hey, look, I can actually take low doses of psilocybin and it helps with my headaches. And so I went down that rabbit hole, and I'm very fortunate now to work with Field Trip Health, which is providing ketamine-assisted psychotherapy today to really help patients. And I'm going to share a lot about that today. I look forward to sharing everything I know about ketamine and where this field is headed. Okay, so just to kind of set the framework, psychedelics really comes from two words. It's psyche and delusion. And really what it means, or is attempting to show, is that the psyche meaning mind or soul, and delusion meaning manifesting or revealing. When you put the words psychedelic together, it's just trying to reveal an individual's mind or their soul or that inner intelligence. And a psychedelic state, is a profound sense of sensory perception, being unfiltered, entering the body. Sometimes you get perceptual distortions, hallucinations, and you get really, really strong emotions, be it, euphoria or despair. The notion in the psychedelic community is that there's not really bad trips or bad experiences, only really difficult ones that we have to work through. And there's a number of ways that we can try to control the environment to try to minimize negative outcomes. I think it's important to understand, why is the psychedelic movement happening, and what's really the baseline of where we're coming from. So I want to take a second to frame the mental health challenge that we face today. So the problem is that current treatments don't really work for everyone. Over 55% of patients relapse after taking their second antidepressant, and that it takes about 4 months until the average person has a relapse to try a second antidepressant. And then one of the problems with, antidepressants, particularly SSRIs or SNRIs, this class of medications we've used for the last 20 to 30 years with not a lot of innovation, is that it takes about 6 weeks to kick in. And that can be really difficult, especially for someone who's dealing with extreme feelings of depression or suicidal ideation. Waiting 6 more weeks could feel like eternity to them. So having other options that work rapidly is just so important for this patient population. If you look at the problem, the solution that we typically offer in this biomedical approach in Western medicine is, if the first medication doesn't work, let's throw on a second one, or let's just flip you to a different one or change your dose. And while that's obviously comes from good intentions, the reality is that the more you go down that line of thinking, the decreased chance that it's going to be successful. So, relapse happens in 40% of people after their first medication, 55% after their second. After their third medication, you're looking at 65%. And by the time you reach your fourth medication, the probability of an antidepressant working is extremely, extremely low. And we live in the context of a global pandemic currently, and this is just really amplifying everything that we had going into the pandemic. And so the rates of depression have increased dramatically. Increased thoughts of suicide have also dramatically increased over the last few years. And the number of Americans that report their mental health has been negatively impacted by this pandemic is over 50%. So we have not just a mental health crisis, we have an exacerbation of a mental health crisis given the current scenario. And if you look at our approach to, depression and anxiety, we have these antidepressants. We do have therapy as well. The reality is all these drugs are studied to be used in the context of therapy. But unfortunately, in many healthcare systems, access to the therapy is typically not covered, or you need private insurance. And so antidepressants work when combined with therapy, probably from a neuroplastic perspective. But the vast majority of people who take antidepressants are just taking the drug in a very passive approach, hoping that the drug will fix them. And they're not really combining it with the therapy. That's a crucial component. And then if you look at some other areas, post-traumatic stress disorder, treatment-resistant depression, major depressive disorder, I would also add eating disorders to this list. We don't have a lot of good treatments. We throw the same pharmaceutical drugs we use for, your run-of-the-mill anxiety or depression at these really complex mental health issues. And so I'm really excited about this psychedelic movement because we really finally have an opportunity to get, hopefully really good science, really good evidence, but to really help in these unmet needs and challenges for patient populations who just really don't have exceptional options. And if you look at eating disorders in particular, and I'm very excited that Field Trip Health is partnering with MAPS to do an eating disorder study with MDMA. But if you look at eating disorders, like 50% of people with eating disorders have chronic suicidal ideation. There's a high morbidity, mortality. It's the number one killer of mental health disease, sadly, and they don't really have good options. So I'm really hopeful and optimistic that the science will lead us to new medicines, and particularly complex mental illnesses. If you look at the socioeconomic impact and disability, I think this is very intuitive to most of us. Like, mental health costs a ton of money, whether it's direct healthcare costs, whether it's medical related absenteeism, lost productivity, short and long-term disability, or a reduction in the quality of life. It costs billions and billions of dollars to service mental health illness. And that's obviously a huge loss to the economy. And so we really need to understand that an investment in mental health and mental well-being will pay dividends down the road. Okay, so this is what Field Trip Health looks like. This is what we do. We're a mental wellness company. We're focused on bringing psychedelic treatment in an evidence-based perspective to the mainstream. And we want to destigmatize, and we want to offer this therapy to the patients who really need it. And you can see in this setting, we have a zero gravity chair. We have specially curated music through headphones, eye shades to force people to go inward when under the influence of these psychedelic drugs, to have an inner world experience, to work through whatever may be going on internally. And we believe passionately, and we know in our hearts that therapy is needed. So for every ketamine clinic that is doing ketamine assisted psychotherapy, there's 5 or 6 that are doing just IV ketamine, who are just giving the ketamine in a biomedical approach without psychotherapy. And I am fairly confident that with time we're going to see that while that does have antidepressive effects, people are going to rely on the drug more and more. They're not going to get that effect, those long-term effects, because they don't have the opportunity for integration with a psychotherapist. So we believe in the ketamine-assisted psychotherapy model. We provide therapists. Therapy is at the front of our treatment paradigm, and ketamine is merely just a conduit to which accelerate the therapy. And that's a really important philosophy in this space. So this is the paradigm shift that's taking place in mental health. You have the current approach, which is the daily use of antidepressants. It's a very passive approach of wait and see what happens. There's a ton of social economic burdens associated with this, and millions and millions of people suffer under this paradigm, this current approach to how we're doing it. And sadly, people just put a lot of faith in the drug. They say, I'm going to take this drug and I hope it makes me feel better. It's very passive. And the reality is that our approach is very, very different. It's an active approach. People have to work hard. It is not easy work, and not everybody who comes to us is really ready for this transformative work that needs to happen. And so we just kindly ask them to pause, and when the time is right, come back to us. So, our approach is to, pursue legal psychedelic therapies, collect evidence and research, and partner with the major institutions to develop the science around novel psychedelic drugs. We're looking for rapid changes in people's mental health and to support them long-term with evidence-based psychotherapy programs. We provide currently ketamine exploration and psychotherapy integration. And what we're really looking for is not a passive approach. We're not going to just subtly make you better or hope that a pill a day will make you better. What we're really hoping for is that you can really, really go deep, work through be it traumas, be it negative experiences, be it pessimistic views, be it really bad relationships in the past. We want you to face those head on and be there as a support team to help you work through that challenge, so it's not weighing on your heart and your soul for the years and years to come. And when those emotional breakthroughs happen, and they do happen often in our clinic, it's remarkable. It's beyond rewarding to be a part of that. And the type of feedback we get from patients is just nothing short of remarkable. And so to help people be there to really be witness to them learning that they have the ability to be their own healer is, it's just, there's no better job from my perspective. So what is ketamine-assisted psychotherapy, the program that we offer? Well, let's talk a little bit about ketamine. Ketamine's a really, really interesting drug because we've had this drug on the market for 20 to 30 years now, 60 to 70 years now. And it's designed as an anesthetic, and its whole intention was to design a safer anesthetic. So most anesthetic drugs we use for surgery, for example, they bring you closer to death. They slow down your heart rate, they slow down your ability to breathe. They're risky drugs. You need an anesthetist watching you because of the danger of these drugs. But people wanted a safer one, and so they designed and came up with ketamine, a synthetic drug. And it doesn't push you closer to death. It helps you dissociate a little bit, but you don't get those cardiovascular and respiratory suppressions that you do with traditional anesthetics. And so we use this every single day in the emergency room. Children take ketamine every day. You know, if they break a bone, they go in, they get that bone reset, and they get a dose of ketamine usually, and it's fairly safe. It was designed as what we call a buddy drug in the Vietnam War. So people would, on the battlefield have, a vial of ketamine next to them. And if the person went down next to them, it was so safe that, you didn't need medical training. You can just give an injection of ketamine, and that would temporarily help with pain relief and dissociation without affecting the cardiorespiratory system. It took about 20 years. About 20 years ago, we started to learn that people who were taking ketamine had improvements in depression. They also had improvements in headaches and pain. And so for the last 20 years, mostly ketamine's been used in the pain field outside of, the anesthetic world. But the last 20 years, we've learned that, hey, ketamine in lower doses, not anesthetic doses, has a lot of antidepressive effects. And what's so unique about it and so different than your traditional antidepressants is that it has a rapid onset. So you don't have to wait 6 weeks to get those benefits. So you can imagine for a suicidal person who has intense feelings of suicidal ideation, getting a dose of ketamine and feeling better rapidly is just so crucial to potentially their survival versus waiting 6 weeks for something to kick in. And that's how it's been used mostly, is in emergency rooms in IV fashion for suicidal ideation. And over the last 5 to 6 years, you started to see these IV ketamine clinics pop up. And now, innovations like what we're offering at Field Trip, ketamine-assisted psychotherapy, combining the best of psychotherapy and then using ketamine as a conduit to accelerate the psychotherapy. What does ketamine do in the body? Well, it modulates a whole host of neurotransmitters. It's extremely complex, but serotonin, dopamine, glutamate, principally glutamate. And all of those molecules, are required for your mood, your anxiety, your consciousness and experience. And it's now reached the point that we do have drugs available on the market with drug identification numbers in the US as well as Canada, and that's Spravato, and it comes in a nasal spray. It is a proprietary form of ketamine. It's just one enantiomer of the ketamine molecule that they have a patent on or intellectual property on with the spray bottle. And so nasal ketamine can be used for treatment-resistant depression as well as suicidal ideation now in Canada and the US. It's fairly expensive given it's proprietary, and when you compare that to generic ketamine, generic ketamine is actually relatively cheap, very cheap. And so what happens when you take ketamine is dissociation takes effects in the brain. You shake the snow globe up a bit. The default mode network, which is our everyday ruminating thoughts, kind of shakes up, and we enter a different state. And with a therapist, you can work on that state and learn from that experience and try to make changes in your day-to-day life for hopefully long-term benefits. So there's a ton of research, believe it or not, on ketamine. I won't go into all of it, but we've known now for over 20 years that it's an antidepressant, that it helps with what we call neuroplasticity, opening up this temporary window of an old brain being able to learn again. So a child's brain is completely neuroplastic and seeing everything for the first time and learning. But as we age, they say somewhere around the age of 25, your brain doesn't have that resilience in terms of neuroplasticity. It's hard to teach an old brain new tricks, but psychedelic drugs really give it that opportunity or that window. We don't know how long that window lasts. lasts for. We don't know if it's just a couple hours or a couple of days, but pairing it with psychotherapy probably in the acute period is probably the best thing. And that's why we do that, because we want to take advantage of that neuroplasticity and try to teach that old brain new tricks. So these are the two approaches with ketamine. I mentioned these IV clinics that have a biomedical approach. They really just give ketamine infusions, and they try to avoid dissociation. They don't want people to disconnect from their ordinary thoughts. They just want to give you the ketamine, not have any sensory perceptual changes if possible, and hope that the ketamine in a passive way just fixes you. And that's very, very different than the ketamine-assisted psychotherapy approach that we take. We either use an injection or a lodging, depending on the jurisdiction, and we're looking for a 40 to 60-minute experience. And we don't shy away from dissociation. The literature clearly shows that dissociation is correlated to clinical outcomes. So as much as people worry about disconnecting or feeling euphoria or a really emotional experience, the data clearly shows that that is necessary to have a profound effect. And so to think otherwise, I think, is a bit naive. I think the medical community is always trying to minimize these, what we call side effects, but in reality, these side effects might be the medicinal effects of these psychedelic drugs working. So we don't shy away from it. We prepare people, we coach them on dosing, we start at low doses. Not everybody has, psychedelic experiences on their first visit. That's not the goal or intention, but we don't shy away from it. We try to explore that space that will manifest, and always, always, always pair this with psychotherapy. So yeah, the whole ketamine-assisted psychotherapy is utilizing a psychedelic molecule to facilitate psychotherapy. Set and setting is so important, and that refers to the mindset of the individual. So are you really ready to make changes? And, if you're a patient coming in and you're getting 100 phone calls, during your visits, you're not mentally prepared, you haven't been doing your mindfulness, that's not a good state to, you can't just go from that busy mind state to a relaxed mind state for self-exploration. So we really spend a lot of time up front trying to understand if patients are ready for this type of work, so preparatory psychotherapy. And then the setting is so important. That's why we've really designed these beautiful clinics so that when you walk into this space, you feel like it's an unfamiliar space, and it kind of primes you for the psychedelic experience. And it's a very safe space with a very committed team who are extremely passionate about helping patients get what they need from this. And what we really want to do is help people access their own inner healing intelligence. No two people are going to have the same experience. And what we want to do is have this come to light that, hey, I might be suffering from depression or anxiety, but I really have the power to heal myself. And each of us will be on a different journey, and we're at different parts in our journey, but we want to be cognizant and empower our patients to feel like they have the confidence that they can be their own healer. And we're merely just, people there watching and partaking. So we do 1 or 2 prep sessions with psychotherapy to make sure they're prepared for that mindset. And then we do 6 ketamine sessions, and that's just based on the literature. And we slowly build it up to target peak experiences. And then we have integration sessions where it's just a specially curated psychotherapy outside of the ketamine. And we're trying to integrate what we learn from the psychedelic experience into their day-to-day life. So this is what that looks like. It's quite an intense schedule. It takes about 13 visits. All the psychotherapy now is being done virtually, and then the 6 sessions with ketamine are being done in person. Okay, what are the benefits? This is what the literature shows: enhanced mental flexibility, which is open-mindedness, rapid antidepressive, anti-anxiety effects, facilitates mental healing and trauma work. And then you get this reprogramming of your default mode network. So 99% of our thoughts are the same every single day. And so to have the opportunity to change that is really a beautiful experience for many people. It's not without risks. Some psychedelics create anxiety or worry, like ketamine, if you take it in the wrong setting or the wrong mindset. Sometimes experiences are very difficult. There are blood pressure, heart ranges changes, but we don't ever typically see that we need to manage that in the clinic. And we don't really know the long-term effects of a lot of these drugs, but I would argue that for most pharmaceuticals, we don't have good long-term data until they're on the market for a very long time. So what is our clinical outcomes showing? So we're showing massive decreases in anxiety and depression. And so you can see in these charts here, people are coming in with severe to moderate to severe depression and mild to moderate anxiety. And we're showing that during post-program and 1-month follow-up that they're having massive decreases in these scores. And this would be a validated questionnaire. This is some of the data as well in the literature showing just ketamine as well. And so the red line is what a placebo shows, just very minor changes in depression scale, but ketamine is showing massive depression. So the literature and what our experiences are essentially matching. So psychedelic medicine is really the next frontier. Field Trip Health is positioning itself as a leader in this field. Our Field Trip Health clinics are, across the U.S. now, and one in Toronto as well. Our Field Trip Discovery is in Jamaica, looking at psychoactive fungi and mushrooms, as well as novel, innovative pharmaceutical molecules. We also have a digital platform that allows people to have mindfulness experiences, and then we have a base camp division that's set up to help with veterans because of their specific needs. At the end of the day, the harms and risks of these drugs are actually not nearly as bad as our legalized drugs, such as alcohol and tobacco. This is a really important study done by David Nutt that just demonstrates that the political regulation of these drugs does not reflect the reality of their harms to an individual and their families. So this is one last study I'm going to show, and this is just showing that, ketamine is really an exciting place that we can work with today, but, psilocybin also is showing remarkable outcomes in a whole host of mental health disorders, and that's why our Field Trip Discovery division is really focused on psychoactive fungi. Okay. And here's some quotes I'll just leave you with from our patients. Feeling like I have direction now and I know what to work on in the future. I feel happy for the first time in a long time. My brain fog has lifted. It feels like I've done the most productive therapy of my life. Okay. This is some of the amazing members of our team. I won't go through everybody today, but we're blessed to have such inspirational and highly motivated individuals. This is what our clinics look like. They're very specifically designed for this type of work. So thank you so much for having me today. And I'm so excited about the future of mental health with psychedelics, and just looking forward to being able to help people heal.